Hey, good afternoon, everybody. Welcome to Women in Midlife. Today, I got somebody a little bit different from all the medical talks that I bring about. Her name is Dr. Chong, and she is a dentist. And I wanted to inform and give you more information, especially for women our age, about our dental care. So stick around, don't go anywhere. Yourself to the audience.
Hello, everyone. So I'm Dr. Chong, and currently I'm working in a Kikyong Dental Surgery. So I've been working there for more than 15 years. It's a very long time.
Young lady, right? But she's 15 years there.
Not young, middle age.
Okay. And your specialty in terms of dental is reconstruction as well. And am I right to say that?
I'm actually a general dental practitioner. That's mean I'm doing all sorts of dental treatments from fillings, restorative, and then even do some simple surgery.
Okay, and it's a comprehensive clinic in Penang, am I right? It has X-ray, I remember seeing.
Yeah, it's a comprehensive. We call it aesthetic implant dental center.
Wow. Okay. All right. So let's get to it. So one of the things I want you to talk about is I can only speak about in Malaysia. Generally, people take dental care as a very secondary alternative. They don't bother very much, especially older people. And what are the more common issues that as we age, what are the more common issues we will get with our teeth?
Okay, I get you, Karen. So the older population actually are prone for having dry mouth. The first problem is dry mouth. And this dry mouth actually can caused by the medicine they're taking or the health condition. Some health condition like hypertension, high cholesterol, or patients are taking antidepressant and causing dry mouth. So what is important with this dry mouth is because saliva actually itself is act as a protective film to protect our teeth from decay. So you have lack of saliva production, that means you're more prone to having a decay. So many people do not realize about this. So they come to us and then we detect that they have dry mouth, and we actually after that giving some recommendation to tackle the problem.
Oh, okay. I learned something new as well. Okay. And what about what the other two things that will happen?
The second problem is most commonly in middle age is gum problem. This is quite common. Receding gum actually are more common in older adults. So when you have receding gum, it's actually easy for bacteria and plaque to accumulate.
Okay, so receding meaning you will it's more exposed, am I right? That your teeth...
the gum line shrink, so exposing more teeth.
Right.
So then that will actually producing more gaps, and bacteria will easily accumulate. Plaque will easily accumulate.
Okay, so in terms of receding, what I understand, correct me if I'm wrong, is that we brush our teeth way too aggressively.
Yeah, you're right, Karen.
Oh, okay.
When we're brushing too hard, actually can also cause the gum to recede faster. So then this will actually eventually leads to like sensitivity to cold water, to sweet drink, to sweet food. But many people do not realize.
Yeah.
So when they come, then only we highlight this problem, and then only they know the effect of brushing hard.
Right. Yeah, because the impression that the harder I brush, the cleaner my teeth.
Correct. Yeah, you're right.
Okay, so your advice is actually get the softest bristle toothbrush, right?
Yeah. Nowadays we encourage is a soft brush and even ultra soft. And the techniques of brushing is also very important because now actually most of the people is under stress. So when they are stressed, they tend to brush harder. You're right. And so the technique of brushing is also very important. The type of toothbrush, all this actually can causing over brushing.
Okay, so when on top of this sensitiveness, right, I see some people doing maybe whitening and even using different types of toothpaste to help desensitize. Is that useful or is not something you would advise?
You mean desensitized toothpaste?
Yes.
Yeah, it do helps in to relieve the sensitivity. So
Okay.
desensitizing toothpaste like Sensodyne, Colgate Sensitive, they all can help to relieve
Right.
sensitivity.
So it's a good.
But at the same time, they also might they may also need to change the habit, like the technique of brushing.
Okay.
They need to correct the technique of brushing, because we don't encourage it actually horizontal brushing. It's more towards vertical or in circular movement.
Like this?
Vertical or circular, which are more gentle to our grandma.
So not the horizontal,
Not the horizontal, because when you do a horizontal, it tends to have a continuous pressure on the teeth.
Okay, all right. And then what else? What is the more common issues that older people will have?
The third one I would say is of course the tooth loss. Tooth loss means is the reduce in the number of teeth in our mouth. So people can get the tooth extracted because of gum problem, of tooth decay. So when they reach middle age, maybe the number of teeth reduce, and then they do not know how to do the replacement of the missing teeth. So when you have lesser teeth, that means the chewing function is not as good during as compared to the young age. So
okay. So when you have tooth loss, when you get older, right? Now I think we need you to explain as to when let's say we pull out that teeth, that tooth, and we don't put a replacement or something, what will happen to it, assuming that is a very key component of our bone structure here? What will happen?
You mean if we pull out the tooth and then we do not replace it?
Yes.
So it will cause the neighboring teeth to move. They will move towards the empty space, and even the opposing teeth will overgrow downwards. So when the tooth move, then automatically the gap between the teeth will open up. So you will feel like food will easily stuck compared to before extraction. Okay.
And does that change your face structure as well at some point? Not so much.
It depends on the type of teeth being extracted. Now, if it is a canine or the front teeth, of course, it will change the appearance because lack of the lip support.
Right.
The teeth will give lip support.
All right. So now, generally, most older folks, they don't really check their teeth. That's something that I learned a lot. And then the old school is they will just pull everything out. Now, for me, I don't know. I don't think that's a solution. Is there new technology to help with people as we get older? We still want to have that structure. We still want to be able to bite. What are the new techniques that are coming up in the dentistry, in the dentist industry? In terms of, is there new way?
Nowadays, if we can save the tooth, nowadays we always advise patients to save the tooth. We make various type of treatment, like root canal treatment, crowning, all these things can help to save the tooth rather than the tooth being
I see. Okay. So, in terms of dentures, all right, are the things that because like for my parents at a very young age, my mother got this advice to pull out all her teeth. So she was just left with like 4 or 5, and that gave her face totally sunk in and all that. And then dependent on dentures. Are there better dentures nowadays available in the market, or is it still the old school, the way that they're doing? What is up in this business because not many people really find out about this to see what are the options that we have for our teeth?
Okay, because like for the older population, because they extracted the tooth at young age. So what will happen is when we extract the teeth, our bone will shrink.
Right.
So over a long span of time, so the bone shrink day by day. So when they reach like 60 or 70, so the bone actually become almost flat. So we need this bone to support the denture. So when we don't have this sufficient bone width to support the denture, so the denture will become loose. So when the denture is loose, then they were unable to eat. So nowadays we have, of course, new technology like to provide more retention to the denture. For example, we will put an implant supported denture.
Okay. So there is something to help so that it stays.
Yeah, it stays. And then that is actually more towards surgery type. But also, of course, not many people actually like ready to go for surgery. Then a simpler type would be like with the adhesive, like polydent that you can easily get.
Okay, understand. And what would you advise for prevention care as we get older? At what age should we do what, and then at what age should we look for certain things to help us prolong out the health of our teeth?
The prevention, it always routine dental check. It's very important. Yeah, we advise actually routine
Twice a year, once a year?
Every 6 months.
Okay, twice a year.
Every 6 months. If they can make it twice a year, it will be twice a year, because by routine checkup, then only we can like detect the sign of early decay or any other symptoms. Apart from tooth problem, we also concentrate more also to the gum problem, and even like detecting sign of like sometimes cancer, early sign of cancer. So we can, sometimes we also detect.
What kind of cancer are you referring to? Nasal?
Oral cancer.
Oral cancer. And what are we looking for? Can you
sometimes I like abnormal white patches inside the mouth, abnormal appearance of ulcer. So we also look at the patient's like lifestyle habit. For example, heavy drinker, heavy smoker, and then we do not chewing, and then they're presented with this kind of white patch, which looks suspicious, and then we will advise the patient to go for the further checkup with the specialist.
Okay. And is it very common here in Malaysia with oral cancer?
So far, maybe in my practice, few cases.
Wow. Okay.
Early detection is very important so that you have a better survival rate.
Yeah, right. And so okay, so of course, from young to old, you should do at least twice a year check, which is just descaling, cleaning up, and then just getting the general checks. And then around your 30s, what are the things that we should be looking out for in your 30s?
In 30s, I guess it will also remain the same.
Yeah.
When you reach 30s, then you will show some sign like I said just now, gum problem, sensitivity. So don't be shy to actually to inform the dentist your problem that you are having. So a communication is very important.
True. So okay, so I had this problem where I drink apple cider vinegar on a daily basis, and I learned from you that actually it was actually help making my teeth erode a little faster than it should. So just to explain to the client, to our audience, basically your teeth will start to keep shrinking because it's like erosion, and then it will cause your teeth to be the nerves to be exposed, right? And that's where more sensitivity and all that. So, but there's so many good components of drinking apple cider vinegar.
Correct.
So what I've been advised by Dr. Chong is to drink it with a straw so that I don't have it swishing around my mouth. And I also learned this, that you don't brush your teeth immediately after drinking it. You actually just drink lots of water to kind of cleanse away and let it sit for a while before you brush your teeth. Because if you do the vinegar and then you brush your teeth, it makes it even worse.
Yeah, correct.
Yeah, so something we learned together on this as well. So okay, great, thank you, and I will let you go off for your duties already, and
Thank you.
thank you for taking time to talk to us. And I will leave all the descriptions for our audience so that they will, if ever they need a doctor to come and check, Dr. Chong is always available. Thank you
Thank
so
you.
much, Dr.
Yeah,
Chong.
thank you.
Have a
Thank
lovely
you.
day.
Yeah,
Bye-bye.
you too. Bye bye.